This is Miss Gurley. I'm going to narrate this PowerPoint on pharmacology and safety, where there's a lot of things that we need to consider to safely administer medications. Our objectives are to discuss the principles that focus on safe administration, and as always, we want to reduce medication errors. Also, we're going to go back and visit. We've already discussed it to some extent in pharmacokinetics and pharmacodynamics, the individual considerations of medication administration. Now, again, there's been a lot of focus on safe medication administration. There were studies in 2000, in the first part of 2000, that illustrated the conclusion of these studies and this research was there was an enormous amount of hospitalizations that were extended or complications patients experienced that was directly related to medication errors. So there has been a huge focus since that time from the Joint Commission and all the accreditation bodies, and of course our North Carolina Board of Nursing is among those. You probably, where the places where you work, you've probably been involved with initiatives, quality improvement initiatives that talk about decreasing medical errors, and particularly medication errors. First, we need to know whose responsibility is what. Now, with safe administration, the providers, the physicians, the advanced practice nurses, which would be the nurse practitioners, the dentist, and physician assistants, they can write and prescribe. They're responsible for assessing the client's medical history and performing a physical exam. Now, as nurses, we are going to be collecting most of that medical history for the physician. He's just going to expound upon it and probe a little further with the patient. But know that you're going to have part of that responsibility of obtaining that medical history, not the end of the road responsibility, but you are going to be the person that's going to initiate it. They are going to diagnose. As nurses, we do not diagnose. Now, we can use our clinical judgment, and we may kind of know ahead of time what's going to happen, and that will help us anticipate what the healthcare provider needs. But the healthcare provider is going to diagnose. They will prescribe medications. Nurses do not prescribe medications unless they're advanced practice nurses. They are going to monitor response. Now, that's also, as a nurse, part of our responsibility, but the end-of-the-road responsibility is that healthcare provider. We as nurses are the provider's eyes and ears, so we report to them the patient's response. And they are the ones that will modify medications as needed. So we as nurses are responsible for knowing our federal, state, Nurse Practice Act, our local laws, and our healthcare policy. And I know that in NUR 111, I'm not sure about NUR 221, but in NUR 111, you are in fact studying those right now in your first unit with them. We need to know how to prepare and administer medications. Where do you give an IM injection? Where is it okay to give a sub-Q injection? What medications will mix? What won't mix? We are responsible for knowing those types of things. And if we have questions, we can go to the physician, but more than likely with preparing medications, our resource is going to be a pharmacist. We need to maintain our knowledge base of medications that we administer. Their uses, their mechanism of action, their routes of administration, safe dose range. We need to be familiar with side effects, adverse responses, precautions, and contraindications. Now, there are thousands of medications out there, and you're thinking, how in the world could I even know all of that? Well, you should have an app on your phone. Medscapes is really a good app to put on your phone. It takes a while to download. There's a lot of info there. It's a very good resource for you. Or you should have a drug book handy or some kind of resource handy. Again, you can call your pharmacist. You will become familiar with the medications and the units for which you work. Like if you work in renal, there's just a certain group of meds that you will routinely give. If you work in geriatrics or in cardiovascular, there's a group of meds that you will become familiar with. So there's no way that you can remember 10,000 drugs that are out there. So just know that the drug that you are responsible for giving to a patient, you need to have looked it up and understand what you're giving, what you need to monitor for. I have put this little mnemonic, compliance, that will assist you in remembering the facts that you have to consider when you're administering medications. Children are not miniature adults. Children use different doses than adults do. I know that with like ibuprofen and Tylenol, they have the little scale on the side that goes by age. But pediatric dosing should be done by weight, not pounds, but kilograms. So children the medication doses for children is always going to be based on kilograms. So if you do not know how to change pounds to kilograms, that is something that you need to be learning, because I'm sure that's on the dosage calculation test. And I think ATI does go over that. So 2.2 kilograms equals a pound. And so all children's weight, they either need to be weighed in kilograms or their weight needs to be converted to kilograms, because that's how you dose a child per kilogram. We want to observe, and I will go back again, children's dosing is done by weight as opposed to age. That's the most accurate way to do it. We're going to observe, report, and then we're going to teach about undesirable effects. What that means is with our patients, if we're starting a new medication on them, we're going to observe them closely, monitor them. We're going to report how they are reacting to that medication. And we are also responsible for teaching that patient about that medication. When should you take it? Should you take it with food, without food? What are some of the side effects of this medication? Okay, this is a side effect, but it is temporary, or it's going to take you so many days to get the appropriate blood level of this medication before you start to notice any difference. You need to be teaching patients about those things. And you will find that in your test, as we move through this course, that you are going to have test questions about what you're teaching the patient. Did you teach it? Does the patient understand what you taught? Meds, we want to drill into our patients' heads. If they're on several medications, they should not take over-the-counter meds without consulting their healthcare provider. One example is if they're on a blood pressure medication, they should not be taking decongestants for colds, because those usually have sufedrin or ephedrine in them, which are going to increase their blood pressure. So they should not be taking any over-the-counter cold medications without consulting with their healthcare provider, because it will increase their blood pressure and counteract their blood pressure medication. That's just one example. Pregnancy and lactating. Women that are pregnant and lactating should take no medications without consulting their healthcare provider. You must have a liver for the L in compliance. You must have a good, intact, functioning liver. We need to look for interactions, and whenever a new drug is prescribed, the doctor should have reviewed that med list, but the doctor is sometimes not as knowledgeable about certain medications as the nurse is. He's used to prescribing his group of medications that relate to whatever his specialty is. So as nurses, we have to be alert for any interactions, and not only drug-drug interactions, but drug-food interactions, like making sure that we're teaching our patient not to eat grapefruit or drink grapefruit juice when they're taking some of the cholesterol meds. We always assess for allergies. A in compliance is for allergies. We always assess for allergies. I don't care if you have allergies written on your chart, 4 places. Before you have that patient, before you give that patient their meds, what kind of allergies? What are your allergies? Review those with them. Nutrition has got to be considered as well. We've already discussed how if they are underweight or if they're overweight, how that might affect their medication absorption, distribution, metabolism, and excretion. But we need to know that if a patient's getting enteral feedings, like a tube feeding, or if they are having trouble swallowing a pill, which pills can we crush and which do we not crush? If you've got a sustained release tablet or pill, they would have an XL, XR, or XL, XR, or ER written after them. You're not going to crush those pills. Or if you've got a capsule that has those little time-release little bubbles on the inside or little particles on the inside, you will not break that tablet apart, nor on those sustained release tablets, you are not crushing those because they're going to get that whole dose right then rather than released over time. Enteric-coated tablets, you will not usually crush. So you've got to know, can I crush this or not? And I've actually, even though the nurses may have been giving a med to a patient with a feeding tube, or they had been crushing meds because the patient could not swallow them well, I've even had students look it up and call the pharmacy before we administer something because there's a question in my mind as to whether you could do that, even though the nurses on the floor have been doing it. So that's a very serious thing. So you need to make sure that it can be safely crushed. C for in compliance is comply with the time and make sure you're teaching your patient to take the full course of the medication as directed. Like if it's an antibiotic, we don't want them to stop the antibiotic when they feel better. The same things with steroids, and there's some other medications that you just don't stop immediately. You need to taper them down. So we want to make sure that the patient is being compliant with taking the medication when they're supposed to and taking the full course. And with the elderly, there's a lot of safety issues that we want to think about the elderly. Can they read the labels? Can they actually maneuver and get the pills out of the bottles? Did they hear your instructions, or did they just shake their head yes? They're hard of hearing and you're giving them instruction about this medication. You've got to verify that they understand it. So what do we need to know prior to medication administration? We need to know the medication category and class. I think I have mentioned this before in this pharmacology course. We're going to concentrate more on the categories or the classes of medication as opposed to the individual meds. You've got to know how it acts. So why am I giving you an anatomy and physiology practice exam? I need to know how well you understand physiology. Because if you don't understand physiology, you cannot understand the mechanism of action for the medications. And that's important to know. If you don't know how it acts, how are you going to be able to evaluate its effectiveness? And how are you going to be able to evaluate trends? Is the blood pressure, is the pulse, is whatever doing what it's supposed to do. So we need to know the mechanism of action and what effect can we expect. We need to understand the side effects and the adverse effects. And you say, well, aren't adverse effects and side effects the same thing? Well, yes and no. A lot of the side effects are unpleasant, but sometimes there are side effects, like with ACE inhibitors. There is a side effect of a little hacking cough that the patients might have. Now, sometimes it's just not that big a deal with patients, but other patients it's a big deal, and it affects different patients differently each time. Adverse effects we usually think about are effects that are uncomfortable for the patient. It's a rash. It might be or it might be dizziness that is affecting their ability to perform their ADLs. We need to know toxic effects. Now, there's some medications that you have to monitor closely. Digoxin is one of those. Some of the antibiotics like gentamicin, tobramycin, or vancomycin, they have a specific range, and if they get above it, you can start getting the toxic effects. So you need to know the warning signs of those toxic effects. Like with digoxin, nausea and vomiting, and the patient may say, I'm seeing like a yellow haze. Well, those are indications that they are having they're getting, their level of digoxin is getting too high. We need to know medication interactions. We talked about the CPY450 competing for the receptors, and but we need to know, do certain medications interact with one another? If both these medications are necessary, just remind the physician these two medications just kind of interact with one another, and then it's up to that healthcare provider to adjust. We need to know precautions and contraindications. Like there are medications that if the patient has renal disease and is maybe stage 4 renal disease, and they only have glomerular filtration rate, their glomerular filtration rate is less than 60, then you don't want to give them that medication, or they need to be getting a reduced dose. Or if it is a medication that is cleared extensively through the liver and there is issues with the liver, then we want to be very cautious. We need to know how to prepare the different medications. We need to know the dosage range that is safe and the proper way to administer it, and our nursing implications. So there is a detailed description of each of these considerations in your ATI pharmacology book on page 11, I think. So make sure you have read those. When we talk about safe administration of medication, one of your test questions is probably going to come from that. I'm going to pause here. I don't like to make the segments too very long, so I'm going to pause here, and then we will do a second segment for this.